Every night while you sleep, your body is quietly pulling calcium out of your bones to keep your blood chemistry stable. That's not a disease, that's normal. It happens to all of us. But after 50, what you put on your plate during the day decides whether that calcium gets replaced, or whether your skeleton slowly, silently, becomes a savings account that only ever gets withdrawals. I want you to sit with that for a second. Bone doesn't hurt when it's weakening. There's no ache, no warning twinge, no symptom at all, until the day there's a fracture from something as small as a stumble on a curb or a cough that cracks a rib. By then, the damage was years in the making. And here's the part almost nobody tells you at a routine checkup. It isn't just calcium and vitamin D. There are foods sitting in ordinary kitchens right now, foods most people over 50 eat several times a week, believing they're perfectly fine, that are quietly working against the very structure holding you upright. Stay with me all the way to the seventh one, because it's the one that fools health-conscious people the most, the one that gets praised in nutrition articles, poured into smoothies, and recommended by well-meaning trainers, while doing something to your bones that almost nobody connects to it. If you've ever been told just eat healthy and assumed that covered bone health too, today is the day that assumption gets tested. My name is Dr. Lim. I'm a physician trained in internal medicine, and I've spent more than 15 years since then working at the intersection of nutrition and biochemistry, the study of what food actually does inside a living body, down to the molecular level, not just on a nutrition label. I'm not here to sell you a supplement, and I'm not here to frighten you into a 12-week program. I'm here to walk you through what the research actually says and what it means for the body you're living in right now. That's the whole job. So let's talk briefly about what bone actually is, because almost nobody explains this. And once you understand it, everything on today's list will make sense instantly. You were probably taught that bone is like a rock, fixed, solid, done growing once you hit adulthood, sitting there unchanged until something breaks it. That is not true, and it's not even close. Bone is living tissue, more like a coral reef than a rock, constantly being broken down by cells called osteoclasts and rebuilt by cells called osteoblasts in a cycle that never stops for your entire life. In your 20s and 30s, the builders were winning. You were laying down more bone than you lost. Sometime in your 40s, for most people, that balance quietly flips. The breakdown crews start slightly outpacing the construction crews. And for women, menopause turns that gentle tilt into a real slope. The drop in estrogen removes a major brake on the breakdown process, and bone loss can accelerate to as much as 2 to 3% a year in the years right around menopause, according to research summarized by the National Institutes of Health. Men lose bone more gradually, but the process is still there, still running, decade after decade. Here's the number that should stay with you through this whole video. The National Osteoporosis Foundation and multiple population studies estimate that roughly 1 in 2 women and up to 1 in 4 men over 50 will suffer an osteoporosis-related fracture in their remaining lifetime. Not might, will, statistically, for half the women watching this and a quarter of the men. And a hip fracture after 50 isn't a broken bone the way it was at 20. It's a hospital stay, a loss of independence, and for a meaningful percentage of people, according to data published in the Journal of the American Geriatric Society, a measurably higher risk of death within the following year, not from the break itself, but from the cascade that follows it. The immobility, the surgery, the pneumonia risk, the loss of muscle. This is not a cosmetic issue. This is one of the highest stakes, most preventable threats to your independence after 50, and it is happening silently, right now, based on choices most people never connect to their skeleton at all. So before we start the list, I want to plant one idea in your head, because you're going to see it show up again and again over the next several minutes in different disguises. Most people think about bone health as addition, more calcium, more dairy, more supplements, and that's not wrong, but it's incomplete, and it's the part everyone already knows. What almost nobody talks about is subtraction, the foods and habits that are actively pulling calcium out of your skeleton, or blocking your body from absorbing what you do eat, or interfering with the hormones that keep the builder cells working. Keep one phrase in your head for the rest of this video: net calcium balance. It's not just what goes in, it's what your body is forced to take out to compensate for what else is happening on your plate. Every single item on this list ties back to that one idea. Some pull calcium out through your kidneys. Some block absorption in your gut. One interferes with the hormone that regulates the whole system. Hold on to net calcium balance, and this entire video will click into place. There's a genuinely Korean angle worth mentioning here, and I want to be honest about it rather than just decorative. Korea has one of the world's most studied fermented food traditions: kimchi, doenjang, the whole culture of jang, fermented soy and vegetables eaten daily for centuries. Some of that tradition turns out to align well with bone health, and I'll show you exactly where later. But I also want to say clearly right up front, because I take accuracy seriously. Traditional and fermented does not automatically mean safe for your skeleton. Some of Korea's own beloved fermented foods carry a genuine sodium load that works against bones exactly the same way any other salty food does. Heritage isn't a shield. The chemistry doesn't care where a food is from. So we'll follow the evidence wherever it points, including when it points at something familiar. Let's begin. Number 1 is table salt, or more precisely, the sodium hiding in nearly everything processed, salted, cured, or canned that you eat in a normal week. This one belongs at the start of the list because it's the most universal and probably the most underestimated. Here's why it's even here. Sodium doesn't touch your bones directly. It touches your kidneys. And your kidneys, it turns out, are calcium's gatekeepers. When sodium levels rise in your bloodstream, your kidneys excrete more sodium into your urine to bring things back into balance, and calcium gets swept out right alongside it, almost as a hostage to the process. Research published through the National Kidney Foundation and multiple clinical nutrition studies estimates that for every extra 2,300 milligrams of sodium you consume in a day, that's roughly 1 teaspoon of salt, easily reached through a couple of servings of deli meat, canned soup, and a handful of pretzels, you can lose an additional 40 to 60 milligrams of calcium through your urine. That sounds small on any single day. Do the math across a year, across a decade, and you start to see the shape of the problem. Your body pulling reserve calcium from your skeleton to replace what your kidneys just flushed away, all because of salt that had nothing to do with your bones in the first place. So what should you do? You don't need to go sodium-free. That's neither realistic nor necessary. Aim to keep your daily sodium under roughly 2,300 milligrams and closer to 1,500 if you already have high blood pressure or kidney concerns, per American Heart Association guidance. The swap is simple. Reach for fresh herbs, garlic, citrus, and vinegar to build flavor instead of the salt shaker. And read labels on anything canned or packaged. You'll be stunned how often a single serving of soup carries half your daily sodium target on its own. Number 2 is going to surprise some of you because it's usually framed as one of the healthiest habits you can have. Your daily cola, or really, any dark soda, whether it's the regular version or the diet one. Here's the "why is this even here" moment. Most people assume the sugar is the only issue, and assume switching to diet solves it. It doesn't, not for this particular concern. The mechanism here runs through phosphoric acid, the ingredient that gives colas their sharp, tangy taste. Several observational studies, including work published in the American Journal of Clinical Nutrition, using data from the long-running Framingham osteoporosis study, found that women who drank cola daily had measurably lower bone mineral density in the hip compared to women who rarely drank it, and this association held for both regular and diet cola, which points toward the phosphoric acid itself, or possibly caffeine displacing calcium-rich beverages in the diet, rather than sugar being the culprit. I want to be precise here because this matters. This is an association from population studies, not a controlled proof of direct cause, but the pattern was consistent enough, and the proposed mechanism is plausible enough, that multiple bone researchers now flag daily cola consumption as a genuine risk factor worth taking seriously, not just a coincidence. High phosphorus intake, especially from an additive form your body absorbs efficiently, can shift the calcium to phosphorus ratio in your blood in a way that triggers the parathyroid gland to pull more calcium from bone to restore the balance. So what should you do? This isn't about never having a soda again. It's about noticing if it's a daily habit rather than an occasional treat. And if it is, start trading 1 can a day for sparkling water with a splash of juice or unsweetened tea. Something that gives you a similar ritual without the phosphoric acid hit several times a week instead of every single day. Number 3, excess alcohol. And I want to be specific about what excess means here, because this isn't a prohibition message. Here's why it earns its place on this list. Alcohol interferes with bone health through at least 3 separate pathways at once, which is part of why researchers take it so seriously. First, alcohol is directly toxic to osteoblasts. The builder cells, studies published in the journal Alcohol Research, have shown that heavier drinking suppresses new bone formation at the cellular level, not just bone maintenance. Second, alcohol impairs your liver's ability to activate vitamin D into the form your gut can actually use to absorb calcium, so even a good vitamin D intake can go partly to waste. Third, it disrupts your body's magnesium and calcium balance and can suppress the hormones involved in bone remodeling. The dose matters enormously here. Moderate drinking, generally defined as up to 1 drink a day for women and up to 2 for men according to the dietary guidelines for Americans, has not been shown to carry the same bone risk. And some studies even show a neutral or mildly protective association at that level, likely tied to other lifestyle factors. But once intake rises above that, particularly into the range researchers classify as heavy drinking, the fracture risk climbs measurably. A meta-analysis in the journal Osteoporosis International found significantly higher hip fracture risk in people with heavy, sustained alcohol use compared to light or non-drinkers. So what should you do? If you drink, Know your actual weekly total, not just what feels normal. It's easy for a glass or two to quietly become more over the course of a week. If you're already past menopause or have any bone density concerns, this is a genuine conversation to have honestly with yourself, and if needed, with your doctor. Now let's pause for one moment because numbers 4 and 5 are the pair that trip up the people who think they're already doing everything right. The ones eating clean, avoiding soda, watching their sodium. These next two aren't about indulgence. They're about foods marketed as virtuous. Number 4 is unfermented soy consumed in very large quantities, and I need to be careful and precise here because this is one of the most misunderstood topics in nutrition, and I don't want to leave you with the wrong impression. Soy itself, in normal dietary amounts, is not the villain some headlines make it out to be. In fact, moderate soy intake is linked in several studies to bone benefits, likely through plant compounds called isoflavones that weakly mimic estrogen's protective bone effects. Here's the actual issue, and it's specific. Soy is naturally high in oxalates, compounds that bind to calcium in your digestive tract and form a complex your body simply can't absorb. So a diet that leans extremely heavily on soy, particularly raw soy milk, tofu, and edamame, as your dominant protein source meal, day after day, can meaningfully reduce how much calcium from that same meal actually makes it into your bloodstream. Research on oxalate calcium binding, published in journals covering mineral metabolism, shows this effect is real, but is primarily a concern with very high concentrated intake, not with soy as an occasional or moderate part of a varied diet. So what should you do? If soy is a small to moderate part of your week, this genuinely is not something to worry about, and I don't want you to swear off tofu based on this. The actual guidance is about balance. Pair soy-based meals with a separate calcium source at a different time of day rather than stacking everything into one oxalate-heavy meal. And make sure soy isn't functionally the only source of protein and calcium in your entire diet. Number 5 is spinach, and yes, I know how that sounds, because spinach gets marketed as one of the great calcium-rich leafy greens, and technically, on paper, it is. Here's the catch almost nobody mentions. Spinach is also one of the highest oxalate foods that exists, and unlike soy, this isn't a very large quantities caveat, it's baked into the vegetable itself. A cup of cooked spinach contains genuinely useful calcium on a nutrition label, somewhere around 240 milligrams. But research on oxalate bioavailability, including studies published in the Journal of the American Dietetic Association, has shown that the calcium in spinach is so tightly bound by its own oxalate content that your body absorbs only around 5% of it, compared to absorption rates of 30% or higher from dairy, or from lower oxalate greens like kale and bok choy. In plain terms, spinach is genuinely rich in calcium and genuinely poor at delivering it to you. That's not a contradiction, that's just chemistry. And it's exactly why read the nutrition label isn't the whole story when it comes to bones. So what should you do? Keep eating spinach. It has real value for folate, vitamin K, and iron. Just don't count on it as your calcium source. If you want a leafy green working for your bones, kale, collard greens, and bok choy hand over their calcium far more efficiently and are a smarter swap if bone density is genuinely your goal with that particular meal. Number 6 is a habit, not a single food. Extremely low protein, low calorie crash dieting, the kind many people turn to after 50 in an effort to manage weight quickly. Here's why this belongs on a bone health list at all, since it seems unrelated on the surface. Your skeleton is roughly half collagen, a protein scaffold, with mineral deposited onto that scaffold to give it hardness. Protein isn't just for muscle, it's structurally part of bone itself. Research published in the American Journal of Clinical Nutrition following older adults on significant calorie-restricted diets found measurable reductions in bone mineral density over as little as 6 to 12 months, particularly when protein intake dropped alongside the calories, and particularly in diets that dropped below roughly 0.8 grams of protein per kilogram of body weight per day, which for many older adults on a strict diet is easier to fall under than people expect. Weight loss itself, especially rapid weight loss, has also been shown in multiple studies to accelerate bone loss independent of protein intake, likely because bone mass adapts downward, along with reduced mechanical loading on the skeleton as body weight drops. So what should you do? If you're managing your weight after 50, and you absolutely should be thoughtful about that for plenty of good reasons, do it gradually and protect your protein intake specifically. Research generally supports 1.0 to 1.2 grams per kilogram of body weight daily for adults over 50, which is meaningfully higher than younger adult recommendations. This is a case where the right move for your bones and the right move for your muscles happen to be the exact same move. Don't let the protein be the first thing that gets cut. And now, number 7, The one I asked you to stay for. The one that fools even genuinely health-conscious people, because it wears the costume of a superfood. Number 7 is excessive vitamin A, specifically from retinol, the preformed animal source version, found concentrated in liver pâté, and many high-dose multivitamin and standalone vitamin A supplements. Here's why this earns the top spot on today's list. Nearly everyone over 50 has been told vitamin A is good for their eyes, their skin, their immune system. All generally true in reasonable amounts, and almost nobody has been told there's an upper limit where it turns from beneficial into a direct threat to bone. Multiple studies, including research published in the Journal of the American Medical Association and a well-known Swedish cohort study following tens of thousands of women over decades, found that women with the highest retinol intake had significantly higher rates of hip fracture compared to women with moderate intake, and the mechanism, as best researchers currently understand it, appears to involve retinol stimulating osteoclast activity, the bone breakdown cells, while simultaneously interfering with vitamin D's ability to support new bone formation. I want to be careful with the framing here, because it matters. This is about excessive preformed retinol, generally intake above roughly 1,500 micrograms a day, sustained over time. Not about vitamin A from beta-carotene in vegetables like carrots and sweet potatoes, which your body converts to vitamin A only as needed and which has not shown the same fracture association in the research. The risk here is concentrated almost entirely in liver consumed frequently and in supplements, and this is genuinely common because a lot of multivitamin formulas marketed at older adults contain vitamin A doses that, stacked on top of a normal diet that already includes some retinol, can push people over that threshold without anyone realizing it. So what should you do? Check the label on your multivitamin tonight. I mean that literally. Pause this video later and go look. And if your vitamin A is listed as retinol, or as a blend that's mostly retinol rather than beta-carotene, and your daily total is creeping past 1,500 micrograms, that's worth a genuine conversation with your doctor or pharmacist, not a decision to make alone. If you enjoy liver, once a month is a very different exposure than once a week. This isn't fear, it's food chemistry. And once you understand the chemistry, none of this feels random anymore. So how do you actually use all of this? Let me give you something practical, because a list of 7 things to worry about isn't useful on its own. What's useful is a simple way to think about your week going forward. 3 habits, nothing exotic, nothing requiring special equipment. First, do a genuine sodium audit for one ordinary day this week, not a diet day, just a normal Tuesday. Add up what's actually in your soup, your bread, your deli meat, your seasoning packets. Most people are stunned by the number, and that number is the single most correctable thing on this entire list. Second, separate your calcium meals from your oxalate-heavy meals where you reasonably can. If lunch is a big spinach salad, let your calcium sources, a yogurt, a piece of cheese, a fortified plant milk, show up at dinner instead, so they're not competing for absorption in the same sitting. And third, this is genuinely where I bring in something from home. In Korean tradition, doenjang, a fermented soybean paste, made through a slow fermentation process that in some ways resembles miso, has been studied for its isoflavone content and its relationship to bone density in Korean population studies, including research published in Korean nutrition journals looking at postmenopausal women's dietary patterns. The fermentation process appears to make certain plant compounds more bioavailable than in unfermented soy. I want to be honest with you about the limits of this evidence. Most of these studies are observational, population-level research, not large randomized controlled trials. So I'm not going to tell you a spoonful of doenjang is a proven bone treatment, because that would be overstating what the science actually shows. But as a modest, sodium-aware addition to a broader pattern, and yes, doenjang is salty, so this isn't a free pass. It has to be counted against your daily sodium number, not ignored because it's traditional. A small amount used as a savory base in a soup or stew a couple of times a week is a genuinely reasonable, evidence-informed habit, not a leap of faith. I want to tell you about a patient I'll call Grace, because I think her story captures why this matters more than any statistic can. Grace was 63 when I met her, several years past menopause, active, walked her neighborhood most mornings, and genuinely thought of herself as someone who ate well. She drank a Diet Cola most afternoons because she'd cut out the regular kind years earlier and felt good about that choice. She took a multivitamin every morning without ever having looked closely at what was in it. Her bone density scan came back showing osteopenia, not yet osteoporosis, but heading there, faster than her age alone would predict. She was frustrated and honestly a little insulted by it, because she'd done what she thought was the responsible thing for years. We went through her days together, the way we've just gone through this list, and none of it was about her already having done something wrong. It was about a few specific correctable gaps she'd simply never had pointed out to her. The phosphoric acid in that daily soda, a multivitamin with more retinol than she needed, a diet that leaned harder on spinach and soy than she realized. Over the following year, she made small trades, not a total overhaul, sparkling water some afternoons instead of soda, a different multivitamin, spacing her big salads and her yogurt across different meals instead of stacking them together. Her next scan showed stabilization, not a dramatic reversal, because that's honestly what bone health usually looks like: slow, undramatic, real. What she told me stuck with me. It felt like something she was finally adding to her health, not one more thing being taken away from her. That's the shift I want for you too. Now, a few honest caveats, because responsible information includes its limits, and I'd rather you hear them from me than discover them the hard way. Everything in this video is general, population-level guidance. It is not personalized medical advice for your specific situation, and it can't be, because I don't know your labs, your medications, or your history. If you're already living with osteoporosis, or you're on dialysis, or you have chronic kidney disease, your sodium, protein, and phosphorus targets may be meaningfully different from the general guidance I've given here, sometimes stricter, sometimes structured differently. That conversation needs to happen with your own physician or a registered dietitian who knows your chart. If you take a blood thinner like warfarin, be aware that vitamin K, found in leafy greens like spinach and kale, needs to stay reasonably consistent day to day, not necessarily low, just steady. A sudden big increase or drop in leafy greens can interact with your medication. So any real change in how much of these greens you eat is worth mentioning at your next appointment. And if you take calcium or vitamin D supplements already, more is not automatically better. There's a real ceiling where excess calcium supplementation has been associated with other health concerns entirely outside of bone. So this is genuinely a check with your doctor about your specific dose situation, not a more must be good situation. None of what I've said today should ever be a reason to stop a medication your doctor has prescribed, skip a bone density screening you're due for, or avoid strength training, sunlight, or anything else genuinely protective. This information is meant to sit alongside your care, not replace it. Let me bring this all the way back for you, quickly, because 7 items is a lot to hold at once. Watch your sodium. It's quietly pulling calcium out through your kidneys every single day. Be honest with yourself about how often that daily cola, regular or diet, is really a daily habit. Keep alcohol in the moderate range, not the heavy range, because the difference in fracture risk between those two is not small. Let soy be part of a varied diet, not your entire diet. Enjoy spinach for what it's good at, and stop counting on it for calcium. Protect your protein if you're managing your weight, because your skeleton is built from it. And go check what's actually in your multivitamin tonight, because vitamin A in the wrong form at the wrong dose is the one almost nobody sees coming. If you're looking for where to start tonight, and only tonight, start with 2 things. Read the label on your multivitamin, and add up the sodium in whatever you're about to eat for dinner. Those 2 take 5 minutes combined, and they're the 2 most likely to be quietly working against you right now without your knowledge. I'd genuinely like to know which of these 7 surprised you the most. Was it the soda, the spinach, or the vitamin A nobody warned you about? Tell me in the comments. I read them. And if this is the kind of real sourced information you want about aging well after 50, subscribe, because that's exactly what this channel is built on. Not fear, not miracle cures, just the research and what it actually means for you. Next week, I want to show you 5 everyday drinks that are quietly raising your blood pressure, and at least one of them is sitting in almost every refrigerator in America right now. I'll see you then.